This is a very quick overview on how to use your GE Fetal Health Monitor. First of all, we're going to look at the buttons on the machine, and then we'll turn it on and see the functionality of them. First and foremost, here is your on and off button. This is your plug-in for the maternal non-invasive blood pressure, and this is your maternal SpO2 monitor. You have three plugins here. The first one is called UA, and that is where your tocometer will be plugged into. Then you have ultrasound 1 and ultrasound 2. That will be for monitoring twins, which we will not be doing. Plug in your ultrasound meter into ultrasound 1. These corresponding volume buttons, volume 1, volume 2, then correspond to ultrasound 1 or 2. So if you need to adjust the volume of your ultrasound, you would adjust the volume up or down on volume 1. This is your alarm silence button. This is the toggle switch, which will select different things on your screen depending on what menu you're in. This is the button you would push to turn on the non-invasive blood pressure cuff. This is your mark offset. So if there was an event that you wanted to mark on your strip, you would click that mark. UA reference, that's the button you're going to push every time you put someone onto this monitor. That's going to reset the baseline of your tocometer. The advanced paper button, that is when you've completed monitoring or need to advance the paper, it'll advance the paper to the next perforation. And this is your record button. So it's going to begin rolling the paper out and recording the waves on your paper. This is a light button that will illuminate this area for you. So we'll go ahead and turn it on. So here's the toco. You'll see when I push the UA reference button, it will set the baseline to 20. That's important to do so that your contractions don't go off the grid up or down. So put it to a nice baseline so you'll be able to see them nicer. Then you'll see how this button highlights different parts of the screen. So first of all, if we go into alarms, we are able to change our alarms to suit our patient's needs. So for you again use your toggle button, just roll it around to get to the spot that you want to change. So we can set our alarms for our systolic and diastolic blood pressures, our MAP, SpO2, all that kind of thing. And then to get out of the screen, you just toggle down to exit and you push the button. Set up, this is a place you're going to want to get familiar with. Important to know that you can adjust the brightness of your screen to fit whatever suits you. We don't want to change the paper speed because the paper we order is set to that. But just to know that on your checks of your maternity room, you should check that the date is correct and that the time here is synced to the clock in your maternity room that you'll be documenting on so that your paper strip comes out with the same time that you're recording with. Fun fact that you can play a song like Happy Birthday or a lullaby. Don't know when you'll ever do that, but just fun to know. Then we'll exit out of this screen. Vital signs history, so you can go back and look at the recordings and measurements of your vital signs of your mom. And then you can go ahead and print all. So that might be helpful and useful for you. This is some settings for the ultrasound. It'll allow you to change the volume. I wouldn't really be adjusting anything inside this menu, honestly. So here is where the non-invasive blood pressure for mom is going to show up. If you push on this one, you can set up however you want to do the blood pressures. So depending on what stage of labor you're in monitoring, you go to mode, you may want to set your blood pressure to go off automatically, and then you can, depending on your clinical situation, it will go off every 1 minute, 2, 5, 10, 15, 20, 30. So wherever you're at, you can change it to automatically go off as you need. And again, you can change your limits for blood pressures. Pulse, same thing. You can go in and change the limits for when it would alarm at you. And same with the SpO2. The transducers that you have hooked up to the Toco and the ultrasound, the Toco looks like this and it says Toco on it. This part would go up and this part goes to mum, and you place it with a strap snugly on the fundus, so the top of the uterus. The ultrasound will have a little heart and ultrasound written on it. This gets attached where you hear the baby's heartbeat best. So you would turn on the machine, use your ultrasound jelly, and find baby's heartbeat. You should perform Leopold's maneuvers to figure out how baby is lying so you can best find the heartbeat. You can also ask mom where she's been feeling the kicks, and the heartbeat will be on the opposite side. So we find baby's heartbeat on their backs. One more thing on how to change the paper. So this button right here, if you push it, will open up the cartridge. Right on the paper it says this side up, and it will say this side down. Sorry about that. Right on the top there are instructions. Hold the pack with the black squares on the right facing down, unfold the top 2 pages, and insert pack into the recorder. So we'll do that. I'll push the paper advance button and see that it's coming out nicely. I know that everything's fine. And so this is the light I was talking about. If your room is dark, you can see your paper a little bit better. So that's a basic overview of how to work your GE fetal monitor. Thanks for listening.